You're very welcome to this talk. It's Friday evening, the 24th of September. Now, lots of people around the world are saying they've got the worst cold they've ever had, and they're wondering if there's some sort of really bad cold virus going around. Well, in the UK at least, the news is that there is not a really bad cold virus going around. It's just the usual cold viruses that are going around. But people's immunity have waned over the past 18 months because they haven't been exposed very much to common colds. So last winter, influenza and common colds were at an all-time record low. Now, these are just a routine part of life, really. We want to prevent them, of course, if we can, especially in vulnerable people, because they can lead to complications in people that are prone to, for example, chronic obstructive airways disease. But there's a fairly strong argument to say that getting these intercurrent infections actually boosts the immune system generally and might protect other immunosurveillance activities as well. And one of those may be cancer, because some cancers are caused by lack of immunity. These are just part of life. They're unpleasant, but they're all part of life, but they all boost the immune system. But let's look at this briefly now. So this is the UK government data, syndromic surveillance. A syndrome is just a clinical condition with many different features, many different signs and symptoms. And this is the weekly summaries for 2021, and it goes down, and you can download the latest one there. And I think that's the week ending the 19th of September. And there you go. It tells you everything you'd like to know, all at the click of a mouse. And of course, I always include all of the references, so you can just click away to your heart's content. I always include those in the references immediately below. Now, lots of people are saying they've had the worst cold ever. So as of the week ending the 19th of September, 111 in the UK is where you call just to sort of about common medical problems, common complaints, just to get a bit of on-call advice. It's not the emergency line. It's just where if you're not feeling very well and you can talk it over with someone, and they can refer you on to a professional if needed. So 111 calls for respiratory-type indicators increased nationally in the UK, and it's also increased in New Zealand and in Hong Kong and in Singapore, I think, and I assume it's increased in the States as well. This is basically everywhere. But in the UK, particularly 1 to 14-year-olds are complaining more of respiratory-type features and respiratory viruses because, of course, they've returned to school and they're mixing again. Combine that with the fact that many have been isolating over a long period of time, and their immunity has waned to these common viruses. And they are common viruses. Also, potential COVID-19 assessments have increased in 5 to 14-year-olds. So this brings us on to what we call the differential diagnosis. Is it COVID or is it a common cold? More on that in a minute. But first of all, common colds are caused by, now there's about 100 different types of rhino. Now, rhino medically just means the nose. So like rhea means runny, so rhinorrhea would be a runny nose, or diarrhea would be a runny fecal material. So rhinoviruses, there's at least 100 different rhinoviruses. This is why you can get two colds quite quickly. You can get one rhinovirus and you can get another rhinovirus. Now, there is some cross-immunity between rhinovirus as well. So if you get one rhinovirus, other rhinoviruses which are similar to it, you're less likely to get immunity. You're less likely to get infected with or severely infected with, because we have this phenomenon of cross-immunity. But of course, none of them have been circulating lately, and that's what's caused this large outbreak. So it's not caused by a new cold virus. It's not caused by a more severe cold virus. In the UK, at least, we know it's caused by the reduction in immunity rather than anything else. There's also RSV, respiratory syncytial virus, can cause common cold type symptoms. This can also cause more common conditions, more severe conditions rather, in children especially. Adenoviruses are common, and we know about these, of course, because of the adenovirus vector vaccines that use these common viruses. And of course, there's 4 types of coronavirus that are non-COVID that can cause the common cold as well. And also common cold symptoms can be caused by influenza and parainfluenza, although these can cause a more full-blown influenza as well, depending on where the virus goes and your level of immunity. So you could have a cold caused by a rhinovirus, and then you get another cold a couple of weeks later and you think, well, I've just had one, but that one could be caused by a coronavirus. or it could be caused by an adenovirus. So there's plenty to choose from. So a degree of cross-immunity between the different coronaviruses and rhinoviruses, but all these different viruses means that you can get between about 3 and 6 common colds per year is the average in the UK. So and it can be really quite debilitating. A bad cold is really quite an inconvenience, and as I say, for people who are predisposed to other medical conditions, it can be a risk and they need monitored. So Dr. Gary Howsam, Vice Chair of the Royal College of GPs, says this. We're starting to see major resurgence of illnesses like common colds, flu and stomach bugs. So the common sort of diarrhea-type upset stomach bugs, upset stomach and upset colon type bugs, like norovirus, for example. I've had norovirus. You get really... Working in hospitals, you get this kind of thing. I got it a couple of years ago, and I was really quite ill for about a week. You get really watery diarrhea, really quite unpleasant, and I felt really wiped out for about a week afterwards, I must say. So alongside the COVID-19 virus in the community, so we've got all these viruses and we've got COVID circulating now, and that's going to be more so in autumn, as autumn comes to us in the northern hemisphere. Now, of course, autumn means that we tend to shut the windows, stay inside, mix inside, breathe each other's air, and it also means we get less sunshine, which means we get less vitamin D. So personally, I've started taking my vitamin D again because I haven't seen much sun actually up in the north of England for a few weeks now, really. So, well, a couple of weeks now. So I've started taking some vitamin D again, and I'll carry on taking that all winter because I've looked at the evidence and I'm convinced that good vitamin D levels are important for immunity. Look at the previous videos we've done on that, make your own mind up, but I'm convinced by the evidence and I take it myself and advise family and friends to take it. You'll have to make your own mind up on it. I can't advise you because I don't know you, but I'm taking it. The guidelines, of course, in the UK are still inadequate. We don't recommend enough. In the Republic of Ireland, I think they're now recommending 25 micrograms a day, which is 1,000 international units, which is much better than the 400 international units, which is about 10 micrograms a day, which is recommended in England, Scotland and Wales and Northern Ireland. So the Irish leading the way on vitamin D advice there. In the United States, I think it's been increased a bit as well, but it's still lower than I would have thought is appropriate. But because we just don't get the sun in winter, we just don't get it. Symptoms of COVID-19 can often be similar to symptoms of illness such as the common cold, of course. So it's important that if a patient does experience symptoms of COVID-19 such as... Now this is this doctor speaking, and he says symptoms such as a high temperature, a new continuous cough, and a loss of the change of smell. Now this is the classic triad: one temperature, cough, loss of smell. 1, 2, 3. That's the common triad. The 3 most common symptoms that's still on the government website. But we know that this is out of date essentially, and it's still not updated. And I'm a bit surprised to see that the Vice Chair of the Royal College of General Practitioners is not more slightly up to date than this, especially as he's speaking publicly. And anyway, he says if this happens, that they get a PCR test immediately, and on receiving a positive result, self-isolate for the required period of time. Interesting. So he's saying you get the symptoms, get the test, and then if the test is positive, you self-isolate. Now, this is not the same as the COVID symptom tracker advice, which says self-isolate first, then get the test. So, but here we have the Vice Chair of the Royal College of General Practitioners saying if you get the classic triad, it doesn't mention any of the other symptoms we now know are there, but if you get this classic triad, then get a test, and if you test positive, then self-isolate. This is part of the problem in this pandemic, isn't it? You know, we get these people that we look up to as like the aficionados of official knowledge, but there's 2 things there that are open to question, and we're going to question them now. But just before we do that, this is Dr. Yvonne Doyle, Medical Director of Public Health England. Hand washing, ventilation and mask wearing aren't only important for COVID-19, but they keep the other bugs at bay as well. So ventilate when we can. No mention of vitamin D, of course, but I've mentioned it, so there you go. Why don't they talk about this? The evidence seems overwhelming to me, but they don't. Right, do I have COVID or a common cold? Now, this is from Tim Spector's Zoe symptom tracker data study. Now, vaccinated or not, whether you're vaccinated or not, this data is showing anosmia, that's the loss of smell, is one of the most common important predictors of testing positive for COVID-19 rather than a regular cold. So in the early stages of a regular cold, that you can lose the sense of smell, but it tends to be later on when your nose is all clogged up with mucus. But in the early stages of a common cold, typically you do not lose your sense of smell. In the early stages of COVID, it's much more common to lose your sense of smell. So whenever I get cold features before I test, I just smell the coffee. And if I can smell the coffee, I think, oh, that's good, I can smell coffee. Just straight out the jar. Or whatever you like smelling, really. Get something you like smelling, give it a good sniff. And if you can smell it as normal, that's a good sign. So anosmia is one of the differential diagnoses. If you get common cold symptoms and lose your sense of smell, that makes COVID much more likely as a diagnosis. Now, if fully vaccinated, as of the 21st of September data, this is data that Tim Spector's team, Zoe team, has been collecting for a long time now. Most common feature, runny nose. Second most common feature, headache. This is people fully vaccinated who get COVID, remember, fully vaccinated who get COVID. Third most common, sneezing. Fourth most common, sore throat. And fifth most common, anosmia. No mention of the classic triad apart from the anosmia. No mention of fever. No mention of new continuous cough, as mentioned by the Vice Chair of the Royal College of General Practitioners. So that's what the data is showing from the Zoe study. If vaccinated, then it's in this order. Headache most common, runny nose second most common, sore throat third most common, fever fourth most common. So that comes in there in the unvaccinated, fever. And then persistent cough as the fifth. So the features that Dr. Gary Howsam from the Vice Chair of the Royal College of General Practitioners is talking about is more those that are unvaccinated, which of course is the vast minority of people now, at least in the UK. Anosmia comes about 6th or 7th actually in the unvaccinated. Now, other symptoms briefly of COVID: chills or fevers. Now, chills or fevers. We know when you get sick, you feel cold, you chill, and you can shiver a bit. That's because your body temperature is trying to go up. It's trying to raise your body temperature because the immune system works better at pyrexial temperatures. When you have a fever, the immune system's working better than when you're at normal temperatures. So it makes sense that the body tries to increase your body temperature. That's why you get these. And if it's really bad, we call that a rigor when you're shaking to try and increase your body temperature. Loss or change of taste as well as smell. Undue fatigue is a COVID feature. Delirium, not really in young people. Delirium really means an acute confusional state. So loss of orientation for time, place and person, usually in that order, would indicate more severe delirium. But it's older people that tend to suffer from this. Skin rashes we know about. Changes in the mouth or tongue, so-called COVID tongue, red and inflamed very often. Red and sore fingers and toes is a COVID feature. Shortness of breath is a COVID feature. Chest pain is a COVID feature, but bear in mind chest pain can be a sign of heart disease as well, so severe chest pain any chest pain should be checked out. Muscle pain, these aches you get all over the place. Hoarse voice. Diarrhea, the gastrointestinal features of COVID. Anorexia means loss of appetite, skipping meals, abdominal pains. So they're all additional features of COVID that have been identified by the COVID symptom tracker app. Now, the COVID symptom tracker people say this: if you feel newly unwell, especially if you're suffering from any of the common cold symptoms, stay at home and get a COVID test, even if you've been vaccinated. So they're saying stay at home first so you don't spread it around, and then get a COVID test. Quite an important difference, and I would have thought that is probably the more expedient way to go, because hospitalisations, although they're going down in the UK and indeed in the States, are still higher than we would like. So we would still like to smooth this out quite a bit for the next few months before things start improving, I think, quite dramatically in the early new year. So lateral flow tests, which we all know about. So we've all got these at home. I'm sure we've all done these. They're free to pick up from any pharmacist or various outlets in the UK. So lateral flow test. Now the thing about the lateral flow tests, specificity is 99.9% and maybe as high as, it's getting on for 100%, 99.97%. In other words, you've got a very low false positive rate. In other words, if you test positive, it basically means you've got it. So a positive test is basically a confirmation. You might want to get a PCR as well. But if you test positive, it basically means you have got the virus. These work best when the viral load is very high, in the day or two before you become symptomatic, and in the first few days after symptoms develop. After about 5 or 6 days, these are very unlikely to test positive, because by 5 or 6 days, the immune system will have reduced the viral load in the vast majority of people, so you're no longer likely to test positive on these, but you will on a PCR. Right, a negative result from lateral flow tests is not totally reliable. In other words, there's a high false negative rate. So if you test yourself with a lateral flow test and you're negative, it means you may or may not be negative. So 72 picked up from those with symptoms, only 58 picked up from those without symptoms. So in other words, to put that the other way around, 28% didn't. 28 is that right? 28%. Yeah, that's right. It missed 28%, and with here it missed. Work it out. 50, is it 50? Anyway, whatever that is. God, my brain's gone blank. Anyway, you can see there's a lot there that are going to be missed. 42%, isn't it? 42% are going to be missed there. So a pretty high rate of false negatives. So testing, finding you don't have the virus, 28% chance the test has simply missed it if you have symptoms, and 42% the test has simply missed it if you don't have symptoms. So if your symptoms persist, it's best to get a PCR test, which of course is completely reliable. The risk with PCR, of course, is if it's got a high concentration number, you could get false positives with the PCR test rather than the risk of a false negative. But we've done all that before. Right, I think we'll leave that there for today. I was going to do a bit of a roundup, but I think that's gone on for long enough. So we'll look at some other facts and figures probably tomorrow. So that's us for today. Thank you for watching. And what I'm going to do is, if I get the symptoms, I'm going to self-isolate, then get the test, and then put myself out of isolation. If I'm negative, if I'm positive on the PCR, then fine. And remember, if you do test positive on this, that means you are almost certainly actually positive on the lateral flow test. So thank you for watching.